Hello friends, today we are going to discuss on the drug interactions. If we see the drug and how it interacts with the person or with the patient, okay. So number of times we see the toxicity, or due to the toxicity the drug that gets affect to the patient and patient may die. So we have to see the drug interaction. Suppose sometime if we take the paracetamol drug with the drugs which plays a role in rheumatoid arthritis. So in that case there may be the drug interaction. So what is drug interaction? It is the reaction, or it is the action in between the two APIs, active pharmaceutical ingredients. Okay. So the drug interaction is defined as the pharmacological activity of one drug is altered by the concomitant use of another drug or by the presence of some other substances. As per our discussion, this is the interaction between the drug and is a pharmacological activity. So in that, this one drug may alter the concomitant, means the action or use of the another drug or by the presence of some other substances. Okay, this is the definition of drug interaction. So next is the drug whose activity is affected by such an interaction is called as the object drug, okay, due to which the activity affect or it changes its activity. Okay, so the interaction that is called the object drug. The agent which precipitates such an interaction is referred to as the precipitant. Okay. So this precipitant and object drug. So types of drug interaction. So this is important parameter in drug interaction. So different types of drug interactions are there. So in that drug interaction, drug food interaction, as we know the example of so many of drug that should not be taken with the milk. Okay. So number of antacids that we take in fasting stomach. Okay. So due to that antacids, this action of that antacid that may reduce due to these foods. Okay. Then as we know gastric emptying time, so that affects on the drug food interaction. So many of drug that we administer after food and some of the drug that we administered with empty stomach. Okay. Then next is the chemical drug interactions. So number of chemicals that we use in our pharmaceutical dosage forms, like number of binders, number of excipients, number of colorants, number of flavors that we use in the chemical drug interaction. So in that case, these chemical drug interaction, it's important. Then drug laboratory test interactions. So different drugs, they play a role with the laboratory test interactions. Then drug disease interaction. Some drugs that alter their action with the disease. Okay. So we will see one by one. The net effect of a drug interaction is generally quantitative, that is increased or decreased effect. Okay. So sometimes the effect of drug interaction that will be the quantitative, that is increased or decreased effect. That's why we check the drug interaction. Okay. Then seldom qualitative, that is rapid or slower effect. So in these, some drugs they gives the rapid effect or sometimes they are slower the effect. Then precipitation of newer or increased adverse effect. Okay. So in these cases, the effect of drug interaction that we observe. Drug interaction are thus, they are mostly undesirable, rarely desirable, means useful. Examples are the enhancement of activity of penicillin when administered with probenecid. So it is very rarely, but most of the time this drug interaction is undesirable or not useful. Okay, here you can see what will be the effect of these two, tablet and capsule, that we have to see with drug interaction. Capsule and this orange food, so how it affects, that we have to study. The different factors they contribute in the drug interactions. So different factors like the multiple drug therapy. So we take the multiple drugs at a time, like antihypertensive and antidiabetic drugs that we administer the single time. So that's why these factors affect to contribute the drug interaction. Then multiple prescribers, sometime the Ayurvedic or homeopathic or allopathic, all the, so multiple prescribers, they will prescribe the drug with their views and number of time they affect on the drug interaction. Then multiple pharmacological effects of drug. So some drugs they gives the multiple effect. Some drugs they are also used antipyretic. Some drugs they used in the that infections. Some drugs they use in the cold cough. So number of pharmacological effects. Due to that effect, these drug interaction that may cause. Then multiple disease or predisposing illness. So this is also one of the major part in the drug interaction. So number of patients, they are having the multiple infections, they are having the multiple allergies, but they supposed to think that if we can't say these diseases or disorder, or if we hide these diseases or disorders due to the fear in the society, the diseases like viral disease, AIDS, or a number of diseases, so the patient they go to hide their this number of diseases or disorders, and due to that the different drug interactions that may cause the results that should get with our that drug that differ due to these drug interactions. Then poor patient compliance, geriatric and pediatric patients, so they gives the poor compliance, so that's why the drug interaction that may cause. Then advancing age of patients, like we have discussed, the geriatric patients, the old age patients, there are number of cases which happens due to this age, the drug interaction may cause. Then drug related factors that also affect on the drug interaction, like if we take the drug that is diclofenac orally, then it gives a good result. But suppose for the topicals, if we take that in a topical form and apply to the skin, then sometimes skin irritation may cause, and it will give the adverse effect. So the drug related factors are also that much of useful or affect. The mechanism of this drug interaction, so this is also one of the important criteria in the drug interaction, how this drug interaction takes place. So there are three mechanisms by which drug and interaction can be developed. So in that case, the pharmaceutical interaction, pharmacokinetic interaction, and pharmacodynamic interaction. So pharmaceutical interactions, they are also called as incompatibility of drug. It is a physicochemical interaction that occurs when drugs are mixed in IV infusion, causing precipitation or inactivation of active principles. So IV infusion is the method in which the causing the precipitation or inactivation of the principles. So examples, there is a popular example of the ampicillin, then chlorpromazine and barbiturates interact with dextran in solutions and are broken down or from chemical compounds. Then pharmacokinetic interactions, the interactions ADME, that is absorption interactions, distribution interactions, metabolism interaction, and excretion interactions. So these interactions are those in which the ADME properties of the object drug is altered by the precipitant, and hence such interactions can also called as ADME interactions. So the resultant effect is altered plasma concentration of the object drug. So absorption interaction, in these are those where the absorption of the object drug is altered. The net effect of such an interaction is faster or slower the drug absorption, more or less complete drug absorption. So this is regarding absorption mechanism. Major mechanism of absorption interactions, they are complexation and absorption, alteration in GI pH, alteration in gut motility, inhibition of GI enzymes, alteration of GI microflora, and malabsorption syndrome. So these all are the mechanism of absorption interactions. So if we see the object drug, then precipitant drug and influence on object area. So absorption interaction in which the complexation that has been takes place, like ciprofloxacin and penicillamine. So antacid food and mineral supplement containing these magnesium, aluminum, phenol, zinc, calcium ions. So formation of properly soluble and unabsorbable complex with such heavy metal ions. Then if we see the alteration of GI pH, so sulfonamides, aspirin, ferrous sulfate, so in which the antacid, sodium bicarbonate, calcium carbonate, that enhance the dissolution and absorption rate. The sodium bicarbonate, they decreases the pollution and dissolution, and hence the absorption takes place. Then alteration in this, the dose or the activity. So in this aspirin, diazepam, levodopa, and this maxilitine, it metoclopramide, so rapid gastric emptying time increases rate of absorption. Then levodopa, lithium carbonate, and maxilitine, so these are anticholinergics. So in this, the delayed gastric emptying time decreases the rate of absorption. So these are the effects that cause due to the drug absorption interaction. Then alteration of these GI microflora. So in this digoxin antibiotics, so increase the viability due to the destruction of this bacterial flora that inactivates digoxin in lower intestine. Then vitamins like A, B12, and digoxin, neomycin is the drug, and inhibition of absorption due to malnutrition. So all these are the factors that affect in the absorption. So remaining part, that is metabolism, distribution, excretion, that we will discuss in the next part. So please visit the next part of this drug interaction. Thank you.